am Dr. Smita Mishra, Associate Director, Paediatric Cardiology, Jaypee Hospital, Sector 128, Noida. If patient underwent some kind of palliation in first 2-3 months of life, when complete procedure should be done for a TOF baby. In these babies, the surgery is usually delayed after 1 year or 2 years of age, depending upon the saturation of the baby. If saturation is low early, say around 1 year, then surgery should be, complete repair should be done around 1 year. Otherwise, we can wait for next 1 or 2 years.